mesentery, and I told you now what is mesentery is a for peritoneum just use the prefix meso, and we will name the structure as a suffix. If your peritoneum is covering the small intestine, we call it mesentery. If that peritoneum is covering the transverse colon, we call it like colon, we call it mesocolon. If it is covering the transverse part of colon, we call it transverse mesocolon, appendicular mesocolon, or and then we have sigmoid mesocolon. So in mesentery we had discussed it is a broad fan-shaped structure. It is having a root and free part, just like a fan. Okay. And root fixed part starts from the duodenojejunal junction between duodenum and jejunum, parts of small intestine. And which ligament is present there? Ligament of trade tarsus. From here to the superior part of right sacroiliac joint, between sacrum and ilium. This is the fixed part of mesentery. And what is the content present in the fixed part of mesentery? We are having first of all third part of duodenum or transverse part of duodenum. Then we are having abdominal aorta. Then we have inferior vena cava. Then we have right gonadal vessels, testicular or ovarian arteries and veins. Then we have right psoas major muscle and right ureter. This is the content present in the root of mesentery, fixed part. And free part, it is attached with the free borders of the jejunum and ilium. Why not duodenum? Because duodenum, it is a which organ? Retroperitoneal organs. So that is why your mesentery free part is attached with the jejunum and ilium. The length of this free part is 20 feet. Why 20 feet? Because the length of the jejunum and ilium is 20 feet. 8 plus 12. 8 feet is jejunum and 12 feet is your ilium. And what is the content present in the free part of this mesentery? We are having superior mesenteric vessel, artery, veins. We have autonomic nerves. Then we have fat. Then we have lymphatics. Okay. Then we have discussed about different ligaments of the peritoneum, like phrenicocholic ligament, falciform ligament, ligamentum teres, and then coronary ligament or ductus or ligamentum venosum. Like phrenicocholic ligament. It is I mentioned earlier, diaphragm and your colon. It is a structure-based classification. Shape-based classification, we have triangular shaped ligament called falciform ligament. It differentiates your right lobe with the left lobe. It is connected with the diaphragm and anterior abdominal wall. The most of the part of the mesentery attached with the posterior abdominal wall, like a root. And then after this free part, we are having transverse mesocolon. That part of the mesentery attached the transverse colon with the posterior abdominal wall. Content is mid-colic vessels. Then we have appendicular mesocolon attached with the appendix with the pelvic wall, and having the content of this colon mesentery is appendicular artery and appendicular vein. Then we have sigmoid mesocolon attached with the posterior abdominal wall, having sigmoidal vessels. This is the content. That was about mesentery. And then ligaments, we are having phrenicocholic ligament attached with the connects the diaphragm with the colon. Then we have falciform ligament of the liver, differentiate right and left lobes, and it is having the content of this ligament is ligamentum teres, which is a remnant of left umbilical vein. So this is an exceptional vein which is having oxygenated blood. What is the another exception, which is a vein which is having oxygenated blood? That is pulmonary vein. So then we have after this we have falciform. Then we have coronary ligament present at the bare area of the liver. The last but not the least, we have ligamentum venosum, which is the remnant of ductus venosus. So that was about ligament. Then we have discussed about lesser sac and greater sac. We have one connection or one foramen which connects the lesser sac with the greater sac. That is called foramen of Winslow or mental foramen or epiploic foramen. What are the boundaries of this foramen? Anterior to this foramen we are having liver. Anterior to this we have omentum, lesser omentum. Posterior to this we are having inferior vena cava. Superior to this foramen we are having liver, and inferior to this foramen we are having duodenum. So these are the boundaries you should never forget as far as the foramen of Winslow is concerned. Then the parts, the recesses of lesser sac having three: superior, inferior, and splenic. Same is true with the greater sac. We having three parts: supracolic, infracolic, and pelvic. In the pelvis we have different pouches. Same like lesser sac, we have only one pouch, hepatorenal pouch. When in peritoneal cavity or peritoneal sac we have pus, and person is just lying on the spine position, that pus will accumulate in the hepatorenal pouch. When that person will stand up, then we have different pouches in the pelvic part of the greater sac. We are having a pouch. Now you will tell me the name of the pouch. I'm talking about female. That sac is present between rectum and vagina. What is the other name of rectovaginal pouch? Pouch of Douglas. Then we have another pouch, a sac present between vagina and urinary bladder. Vaginal pouch. Then let's discuss about male. We do not have vagina, or we have? No. So we have only rectum, and due to that we have urinary bladder. What is the name of this sac? Rectovesical. If we ask about the boundaries, obviously you will tell anterior we have urinary bladder, posterior we have rectum, and inferior we have a rectovesicular peritoneal fold. And why they are important? Because that sac is being used for the peritoneal dialysis also in end-stage renal disorders, renal failure, and they are most dependable parts. When you are having any pus or infection and you are standing upward position, that infection, that pus will go towards that pouch. And most important pouch is pouch of Douglas, that is present just behind, or you can just behind the vagina, or you can say your female's vagina and uterus just sitting or lying on the pouch of Douglas. And if there is any pathology with the vagina or the uterus, then female will feel pain during sexual intercourse, like endometriosis. We are having a simple lining of the uterus, endometrium, myometrium, and perimetrium. But if endometrium is present other than the uterus, we call it endometriosis. Or if the thickness of the uterus is more than 14 mm, then there will be problem or pain during the sexual intercourse. Or if someone is having infection of the pouch of Douglas, again the female will suffer. Obviously female is having pouch of Douglas, males mein to nahi hoti. So the terminology we use for the painful sexual intercourse is dyspareunia, painful sexual intercourse. So, and I have discussed about types of dialysis. We have peritoneal dialysis and hemodialysis. And hemodialysis, hemo means blood, in which we make a fistula or shunt between artery and vein, like radial artery and cephalic vein. But in peritoneal dialysis, we give a dialysate fluid. Like peritoneal dialysis, if you want to do an end-stage renal failure to the pouch of Douglas, you will just insert a dialysate fluid in the peritoneal sac. And from the sac, dialysate will give the nutrients and will, most importantly, will catch the waste products or toxic material from the body, and then that fluid will again come back to the peritoneal dialysis machine. So that is a clinically important, or you can significance of these pouches. Okay. Yes. And from the anus, if you want to go from the anus in males, you have to go 7.5 centimeter, or you can say the distance of rectovesicular pouch is 7.5 centimeter from the anus, and the distance of pouch of Douglas or rectovaginal pouch from the anus is 5.5 centimeter. 7 centimeter. Obviously, you will not go directly. You have to measure, having aseptic measures, gloves, and all these things you can do like that. So anything I left, like side puckers we have discussed earlier also. So that was about today's class. Thank you so much. Now I